Shamik Bafna. Shamik, we're going to be talking about something that's of interest to me in the context of my own practice, which is the use of Dextenza, which is, just to be clear, just to set context for those of you who don't know, and correct me if I have this wrong, it is a punctal plug that's impregnated with steroid, such that the steroid leaches out into the tear film, is absorbed in the eye, so the patient does not have to use steroid eye drops following cataract surgery. Did I get that right?
So pretty close. It's actually an intracanalicular insert. And essentially what happens is it's been FDA approved for the treatment of pain and inflammation after ophthalmic surgery. What's nice about it is that it goes ahead and provides for a sustained and tapered release of dexamethasone that goes ahead and reduces the need for corticosteroids overall. So then you don't have to worry about patient compliance issues in that situation.
Right, so just to be clear for me, so the patients, a normal patient, a normal case after cataract surgery will not have to use topical steroid drops after cataract surgery. This will carry them through that post-op period.
Absolutely correct. That you do not have to use topical corticosteroids after that.
Okay, so I have, it's not available yet in our ambulatory surgery center, but it's going to be within the next few weeks. I'm excited because although my patients are absolutely compliant with everything I've ever told them, I understand there are other surgeons who have lesser patients.
Absolutely.
But I have one concern, and it stems from completely something else. So for those patients for whom I've done triamcinolone staining for vitrectomy, there is triamcinolone that's in the eye for a long time, and some of these patients will go on to develop elevated intraocular pressures, not immediately, but sometime after. And unlike with topical steroids, you can't tell them to stop because it's a depot medication. How concerned do I have to be about IOP elevation after putting in Dextenza, which ultimately I can't take out? It's just got to melt.
Correct. So actually that's a great point, and that's why we conducted this study where we looked at over 900 patients through 3 phase 3 trials. And essentially these patients received Dextenza after cataract surgery, and they were evaluated at postoperative day number 1, number 3, 1 week, 2 weeks, and 1 month after surgery. What we found is we went ahead and compared that with placebo. And on postoperative day number 1, there was an elevation in intraocular pressure in both the Dextenza group as well as the placebo group.
Post-op date number
which
1,
we
it's
would
not going to be
expect.
steroid. Post-op date number
Absolutely.
1,
it's
going to
completely
be
viscoelastic.
Yeah.
But then what was nice is in all subsequent days, the pressure went ahead and resolved itself, and there was no statistically significant difference between placebo versus the Dextenza insert itself. So the nice part about the study, it indicated that even though the insert was providing for corticosteroids, there was no real elevation of intraocular pressure in that situation.
So let me, I want to beat this horse a little bit more. I'm not asking you a question about who is and is not a candidate for Dextenza, except for one very, very narrow segment of patients. I do lots of MIGS. I love MIGS. In fact, I may like the MIGS part of the surgery more than the cataract part of the surgery. Okay. Should I be hesitant about using Dextenza with MIGS because these are patients who I'm especially interested in not elevated intraocular pressure?
Absolutely. In my opinion, I don't feel that you have to be worried about that. I actually have patients that I go ahead and place Dextenza currently on that they'll go ahead and have concomitant MIGS at the same time. And I don't change anything, whether it's just the cataract surgery alone or with MIGS as well. So from my perspective, there is no increased elevated corticosteroid risk with this.
Okay. Since I have you here, I'm just going to pick your brain for some pearls. I've put in more punctal plugs than I have hair on my head. Is Dextenza put in like a punctal plug, except that the patient is supine? How do you put it in?
So it's very easy, actually. Basically, what you do is you go ahead and dilate the puncta. This is typically after cataract surgery, so you'll go ahead and dilate the puncta.
After cataract surgery, but the patient's still on the
patient
table.
is still lying flat.
Yeah.
Exactly. So you dilate the puncta. What is really, really important is you want to dry off the puncta, because what happens is once the insert has any type of hydration, it tends to balloon up.
Yeah, just like collagen plugs do.
Exactly.
Yeah.
So you go ahead and dry the puncta, then you go ahead and place the Dextenza right through the insert into the canaliculus. So it's actually very easy and very straightforward. Takes about 30 seconds after the cataract surgery.
Is there any um, is there anything that's externally visible that confirms for you that steroid is in fact leaching out of it? That I didn't just, you
Right.
know.
So there's nothing that you can physically see as far as the steroid itself. But what's nice is the Dextenza insert is fluorescein conjugated. So what you can do is go ahead and
Ah.
place a blue light with a yellow filter, and you can confirm the presence of the plug. So there was a separate study that looked at extrusion of Dextenza, and they found that it was less than 0.5% over a period of 30 days. So what is nice is it does tend, and the other nice part about this insert is that it stays in place for 30 days and then it resorbs on its own without the need for removal. So you can confirm that it's there, plus you know that it's going to go away by itself.
So at the slit lamp, can I use a cobalt filter and see fluorescein in the tear pool? Is that
You won't see fluorescein, but you can actually see a little yellowing of where the Dextenza insert is located. In that
within
location.
the
Within the canaliculus. You
That's
can
really
actually
interesting.
visualize that. So it's very easy to confirm that the patient has not lost it or anything like that.
Right. That I haven't been so forceful putting it in that it's in the turbinate somewhere. Yeah, no, that sounds great. So do, do you do you use it for all of your cataract patients?
So I was actually one of the lead investigators in one of the clinical trials. At this point, I've not started reusing it since it became commercially available, but I plan on going ahead and trying it out once now it's commercially available.
Are there patients for whom you would plan initially to also supplement with a topical steroid? Do you know? I mean,
Right.
and I've this patient in which there's been a lot of manipulation of the iris. Now, having said that, for the most part, those patients I don't start on a topical steroid dose that's any more frequent than I do for my regular patients. I just play
Right.
it by ear. But
So for me, if I have a patient that's diabetic, that I'm worried about, they've got diabetic disease, I'm worried about CME or stuff like that, that would be a perfect example where I could go ahead and place an insert. I no longer have to worry about patient compliance regarding that situation, but then I may augment that with additional
with an
corticosteroid
NSAID or
drops
something,
or an NSAID
okay, yeah,
to try to supplement. But an NSAID would probably make more sense because you want to try to prevent CME. So
yeah.
those would be cases where you may want to supplement it. But in majority of cataract surgeries, that by itself should be sufficient.
Well, Shamik, this sounds great. I mean, I have to tell you the truth. I didn't have that much anxiety about using this product, but I was definitely thinking about whether this would be something that I would get burnt on with a MIGS patient with an elevated pressure. I wouldn't be able to get this thing out. So I'm very happy to hear this. I want to thank you for bringing this good news, and Shamik, for being so very generous with your time with me today.
Oh, thank you very much.